So
stuck here.
I'm
All right,
going
okay,
to
I'll let you
take
go.
you to the next generation of. Let's not talk about the next generation. Let's talk about the future. So in the past, we talked about fully ablative CO2. Of course, many adverse effects. It was very problematic, many complications. And then with the evolution of lasers, we actually talked about non-ablative fractional laser and fractional ablative lasers. So from 2007, there are so many devices you can see in the exhibition, so many devices, non-ablative fractional lasers and fractional ablative lasers, and of course, fractional ablative lasers will provide you with really
Can we lean
good
back a little bit more?
aesthetic outcome. However, high rate of complications, long downtime, so it's not suitable for every patient. Talking about non-ablative fractional laser, again, different wavelength in the market, you need to have several treatments. Usually, it's a mild procedure to perform, but we know subtle results, and many patients, especially in this era, this period in which Instagram, Facebook, people really want result, it's very difficult to really provide our patient with a result or true result with non-ablative fractional laser. This is the reason in the 5 past years, there is a new era, what we call the hybrid era. So it's a combination of non-ablative fractional laser and ablative fractional laser in some organization. It's either first the non-ablative fractional laser, follow immediately by ablative fractional laser, or different combination. Today, I'm standing here on behalf of Alma Laser, and I'm going to share with you, I'm going to show you the next generation of hybrid laser. So have a look. This is the device. I will ask the cameraman to look at the device. So if you see the screen, you have one parameter which is very important. This is the high grid ratio. You can decide how many pixels will be fractional ablative CO2 and how many pixels will be non-ablative fractional laser. If it's 1:1, so this is the ratio, so 50% of the pixels will be CO2 and 50% of the pixels will be non-ablative fractional lasers in the wavelengths of 1570. And we talk about side by side. So one CO2, one 1570, one CO2, one 1570. And you can actually change it all. So for example, now I change the ratio. Have a look. This is 1:2. Now 2/3 of the beams will be non-ablative, and 1/3 of the beams will be ablative. If we talk about 1:3, again, 75% of the pixels will be non-ablative, and only 25% will be CO2, and you can actually reverse it, so to be less aggressive. So this is 2:1, so this is 2/3 of the beams, so 66.6, 2/3 of the beams will be ablative, and only 1/3 will be non-ablative, and again, you can change the ratio. If you can control the ratio between ablative and non-ablative. This is the new kid on the block. So I want to share with you my experience, and I'm going to talk about this patient in a second. One last comment to really show you. So apart from the different ratio which can be determined, you have the CO2, all the settings, so of course the power, the on time, you have the 1570, okay, the non-ablative fractional laser, again, power and on time. We talked about the ratio, and here you can actually change the density. So the density of treatment from the lowest density to the highest density, which becomes nearly ablative. So every parameter can be changed in order to actually determine the amount of ablation and non-ablation, the amount of coagulation versus ablation, the depth of the crater, the width of the coagulation zones, and it opens the gate to many modalities that we couldn't treat in the past, or we could treat either with ablative fractional laser, but with many complications, or with non-ablative fractional laser, but then the results were quite, I would say, subtle, and we needed too many treatments. So this is the hybrid system, and I will show you how it works. Let's have a look at our patient. So we have a 40-year-old patient. Please, if you can move your face. And please, the cameraman, if you can zoom in to show the skin texture. So talking about this patient, this is an Asian thick skin. There is some acne scars, so the skin is not homogeneous. And you can see some hyperpigmentation. And talking about the hyperpigmentation, this is melasma. Okay, you can see it. It's very clear on skin. You can even see the dotted hypopigmentation and the patches of the hyperpigmentation in the malar region and on the upper lip, in the area of the barcode. And how do we treat such patients? So for sure, if we go with fractional ablative CO2, we are going to have many complications. So PIH is one of them, and maybe this is not the way to go. However, if we want to treat the acne scars, going with any non-ablative fractional laser in different pulse duration, including the picosecond laser, we might have mild result. In order to solve this issue, we use the hybrid laser. The hybrid laser in this setting will combine 1570 nanometer laser and CO2 laser. However, because of skin quality and because of the melasma, we are going to choose different ratio. So have a look again with the camera. So the ratio that will be chosen is 2:1, okay, 2:1. So 2/3 of the pixels will be 1570. We are going to lower the power, and we are going to lower the on time. And we are going to have the CO2 relatively low setting with the on time, so pulse duration of 0.8. This is very, very short, and there is less thermal effect. Now again, the ratio is 1:2, more non-ablative. We are going to go and use not the lowest density. We are going to use level 2. This is a moderate density. And on top of it, we are going to apply something which will accentuate, will make our results better. So let's see how the treatment is performed. I will ask the patient, can you please put the goggles? Can you elevate your head? Yep. Okay, this is one. Perfect. So, have a look. Again, a very interesting laser. Let's change. Okay. Okay, come to this direction, and we treat the skin. If the camera laser can come close, it's very difficult to see it because you only see the zone. Can you open it? Can you open the gauze? Thank you. So you only see the white dots, and the white dots, they are the areas of CO2. Okay? So you see the white dots, but you don't see the red dots, which are in between, and this is the majority. This is most of the pixel. So I remind you that what I chose is 2/3 of the beams to be non-ablative, relatively low setting non-ablative, and only 1/3 of the beams of the pixel to be CO2. Again, this is a very easy treatment. What is the pain? Is it painful? Can you ask her in Thai? A little bit. In a scale of 1 to 10, when 10 is it's horribly, 1 is unpleasant. I think she thinks she doesn't really feel it. From
เอาสักห้า
5, so she doesn't really know what is the pain level. Usually, when I ask my patient what is the pain level from, let's say, 1 to 10, and 9 or 10, it's pain that you really faint, and 1 and 2 is unpleasant feeling. And even with the higher settings of this device, usually what they say between 3 and 5. But 5, this is for the rejuvenation. Okay, so you can see this is the area of the treatment. Let's finish it. So I'm going over all the skin. Now, this modality can be combined with other modalities, especially for the treatment of acne scars. For example, she used to have ice pick scars, so you could do cross TCA just prior to this treatment at the same setting, okay? At the same setting. So as you can see, I covered this area. Mild redness, you see the dots of the CO2. This is third of the beam. 2/3 are non-ablative, and it cannot be seen. Let's go to the other side. Let's start from here. It's going to be easier for you to see. This is a very easy treatment to perform. At least the non-ablative part, I delegate to my assistant, to my nurse. The downtime of such a treatment as compared to the CO2, this is approximately 24 to 72 hours. So this is relatively a long recovery as compared to what we are used. And regarding performance, this is not another non-ablative fractional laser. It changes the perspective, because this is actually like CO2 without having CO2, because we replaced 2/3 of the beam with non-ablative fractional beam. The treatment becomes, first, more tolerable, second, less adverse effect, and the downtime is really short. Okay? So this is last one that I want to do here. Another one here. Okay? And now for the last step. So this platform, apart from having non-ablative fractional laser and ablative fractional laser, there is another system. This is the sonophoresis. This is ultrasound by which we can apply medications or cosmeceutical into the skin. So have a look how we do it. The sound, it's not painful, but the sound, because of the ultrasound, it's horrible. I'm always warning my patient. She will hear it's like going to the dentist. So I'm applying, this is non-cross-link HA together with azelaic acid. And what I do, okay, I just go over the skin, and you will see, because I created channels with the CO2 laser, so all material is gone into the skin immediately. And you will see that there is nothing left on skin surface. So this is what we called enhanced laser-assisted drug delivery. It enhances the result, and in this patient with acne scar and some pigmentary alteration, this is an amazing treatment. You are going to have good result, and relatively, you see how all the material is getting into the skin, nothing is left. So with this combination, you maximize your result. So I'll do the other side, and then we're going to finish. Let's go to the other side. So let's summarize our treatment, and with that, I'm going to move the next. You're going to move to the next demonstration. I think that I invited you to watch I would say, the future. So as compared to the past in which we talked about non-ablative fractional laser and ablative and non-ablative fractional laser and ablative fractional laser, this is not the case anymore. Now we're in the era of hybrid laser. So what we do, we combine between wavelength, non-ablative wavelength, and ablative wavelengths. This device, this is the new generation, this is the new kid on the block, and you can really plan your treatment. So you have different pixels, and you can actually decide for different patients, for different indications, for different body area, how many pixels you want CO2, how many pixels you want non-ablative fractional laser, and which drug or cosmeceutical can be put afterwards. Thank you very much.